Hello, welcome back to the channel. Today's news takes us into the health sector where tensions continue to rise over the issue of undocumented foreign nationals and access to South African public health care. Please watch until the end so you can see the sources and try to verify this news for yourself. And while you are here, don't forget to hit that subscribe button and stay updated with the latest news making waves across the country. Reports have surfaced that 15 pregnant Zimbabwean women were allegedly chased out of a hospital in South Africa after trying to access maternity services without proper documentation. The situation has raised heated debates, with some people arguing that South Africa's already overstretched healthcare system cannot continue to provide free services to undocumented migrants, while others feel it's inhumane to deny pregnant women help, especially when they are at such a vulnerable stage. According to accounts from healthcare workers, the women entered the facility quietly, blending in with other patients, but suspicions arose when documents were requested and many could not produce valid papers or proof of residency. At that point, hospital staff reportedly escalated the matter to management, who then involved security to escort them out. The incident has sparked outrage and mixed emotions both within the community and online. On one side, South Africans are voicing frustration that hospitals are collapsing under the pressure of trying to cater for too many patients, many of whom are not citizens. South Africa's public hospitals are already struggling with long queues, shortages of staff, and limited resources. Citizens argue that their tax money should primarily serve them, especially when it comes to maternity care, which is often expensive and life-saving. On the other side, human rights advocates and some local residents argue that denying healthcare to pregnant women can have dire consequences. For them, the issue goes beyond borders and politics, it is about human dignity and compassion. The fact that these women are pregnant adds another layer of urgency because their unborn babies could also be at risk if proper medical attention is denied. The event has reignited calls for stricter border management and better systems to monitor access to healthcare. Some officials are saying the Department of Home Affairs and the Department of Health need to work together to ensure hospitals don't become overwhelmed. Suggestions include introducing stricter verification processes, but also providing emergency humanitarian care where necessary to avoid tragedies. This is not the first time such incidents have been reported. Over the years, South Africa has faced mounting pressure over the influx of foreign nationals, particularly from neighboring Zimbabwe, due to economic challenges there. Hospitals in border provinces are often the hardest hit, with maternity wards and emergency units carrying a heavy load. For South Africans, the question remains, how do we balance the need for compassion with the need to protect a healthcare system that is already under severe strain? For foreign nationals, especially those from struggling economies, the question is, where else can they turn when their own countries cannot provide them with the healthcare they need? The discussion continues across communities, with strong opinions on both sides. It's a complex situation, and as usual, there are no easy answers. But one thing is clear, South Africa's healthcare system remains under immense pressure, and without proper reforms, stories like this may continue to surface. So, what are your thoughts on this situation? Do you think the hospital was right to act the way it did, or should healthcare workers always provide care regardless of documentation? Share your views in the comments, I would really like to hear from you. Before we wrap up, make sure you subscribe if you haven't already, because we bring you the latest updates that matter to everyday South Africans. And let's be honest, sometimes, the news is so dramatic, it feels like we're living in a soap opera. The only difference is, there are no commercial breaks, just cues at Home Affairs. All images used are for illustration purposes only. News sources: Sowetan Live, Times Live, Daily Maverick.